Welcome to the Express Soul Health and Wellness Podcast. In each episode, you'll learn from experts about the best practices and technologies to live a happier, healthier, and hopefully a longer life. Here is your host, Claudia Erdenola.
Do you know what is the Superhuman Protocol? Hi, my name is Claudia Erdenola, and this is Express Soul Health and Wellness Podcast. Today, my guest is Dr. David Lipman. Dr. Lipman is a doctor of chiropractic medicine in Boca Raton, Florida, and he is going to tell us what is the Superhuman Protocol. How is that technology available for all of us today when before it was only available for the super athletes or the training of soldiers? Now these technologies are basically available to everyone, and they're very, very good on preventive medicine. So if this is a subject of your interest, please keep on watching. Hear my interview with Dr. David Lipman. Please don't forget to subscribe. Subscribe right here and hit the notification button so you will be notified when we got more episodes and more content in our podcast. Help us to spread the word on wellness. And please, if you are so kind to write a good review right here, I would appreciate it. That way, many others will find our podcast content and we will help spread the word on wellness. How are you today, Dr. Lipman?
Outstanding, Claudia, and thank you so much for having me on this podcast. I was looking forward to it since we scheduled it, so I'm glad that it's here today.
Yes, absolutely. I'm happy you're here with us too. We have several subjects that I like my listeners to have a very good informative session from you that are the experts. So tell us a little bit about yourself, your professional background.
Yeah, sure. So I really think that my professional background started with my own personal life. I was very fortunate when I was 10 years old to be exposed to exercise and healthy eating at a very young age. There was a boy next door that was a couple of years older. His father was into martial arts and Eastern philosophy, and he got me off of Captain Crunch and Wonder Bread back when I was 10 years old and got me into exercising as a part of my daily routine, actually first thing in the morning. So that really took a foothold in me at an early age. And, everybody around me thought it was crazy because nobody really worked out then. There weren't really gyms. Jacqueline wasn't quite up and around yet, but it's something that really spoke to me. And as I grew older, I started to have like a personal health journey. I had some injuries at a young age. I had a dislocated shoulder when I was 5. I had broke my neck when I was 15 in a motorcycle accident. And those injuries had prompted me to really start looking as to what can I do to manage it, because inherently I just thought that the healthcare industry might not have all the answers. And since I was sort of already believing in the body's ability to heal itself based on those initial exposures and understanding how food and also lifestyle will start to affect you, I wanted to see if that could be my answer. And of course, that took me on a personal health journey that became part of a professional journey as a chiropractic physician. I was attracted to the practice and the industry because how it really gets to optimize the body's own functioning. So it all kind of melded together with things that were, part of my mindset growing up. Now, of course, where we're in this modern age where we're faced with what I would consider a healthcare system that's largely failed people, and people are really not feeling good anymore as they should, because the modern world is hurting us in so many ways. But the good news is at the same time, there's awareness to these other technologies and therapies and lifestyle changes and biohacking that can really tap into that body's, resource again to help heal people. So you can actually continue to what I would call regenerate as you get older instead of degenerate.
You're absolutely right. And you touch on something that is many good points here. But one, I think that the people are becoming more aware that they can do something else to control their own health. We pass that point where we have to surrender our decisions to what the doctor is telling us. We have channels such as this podcast, Express All Health and Wellness podcast, bringing information from professionals, different points of view, different protocols, different applications, technologies that people can be reaching and going to and implementing their lives to become a better, healthier person, happier person, live longer, love longer. So as of right now, I think that what happened during the COVID years is that people start looking at to themselves. What can we do to prevent it? Preventively just do at home, do for ourselves to be at a better place if COVID comes, if comes another virus, in another disease comes, we know how to navigate this at ease. We are in better shape. So that's what it really caught my attention when I came to your practice and I saw what you were doing. And I want you to tell us a little bit about that. What do you do at your practice?
Yeah. So again, as part of my own personal health journey, and that involves going out and looking for some of these newer technologies and see what the benefits are, I really get them and implement them here in my office for me to use. However, as a chiropractic physician, a lot of the things that I bring in are things that people have never heard of before. So it becomes an opportunity for me to be a resource to people because they might be accessing me for chiropractic care or some of the other modalities like whole body cryotherapy, photobiomodulation, or red light therapy, and some of the other things that we do here. But this is a great opportunity for me to share some of the things that I've been of benefit for and things that I implement here. And again, because it's something that is really effective, I can walk the walk, so to speak, because I've seen the difference in how, in my 60s now, I feel like I did when I was in my 30s, but more because of, and I think this is really what's important. A lot of people look at healthcare as an expense. I look at health as an investment.
Totally agree with you in a preventive way. I mean, something else I have to tell my audience, you are in a great shape. And when I see my doctor in a great shape, I know that he already walked the walk, as you just said. You are doing for others what you do for yourself to keep yourself healthy, vibrant, strong. So that's something important. If I go to find advice on nutrition and the person that is giving me that advice is overweight, and I know that probably is carrying inflammation in the body, is abusing the organs, I don't gonna get advice for somebody like that. I won't. I mean, that is telling me 1,000 words more than anything else. Anything that he says is to me, unfortunately, I won't take that advice. And this is something that I personally apply to myself, it does make sense. So I know that at your practice, you probably are combining all of those experiences in your private life, in your personal life, and bringing to all of those technologies and ways that you are basically tailoring this protocol for your patients. Now, this is where it gets interesting to me. I got to read what is to be a superhuman. What is the superhuman protocol? Let's tell our audience, what is the superhuman protocol? What's that?
Yeah, so Superhuman Protocol is a 3-step process involving 3 therapies that we use here, and the sequencing of them is very important. Now, each one of these therapies by themselves have great benefit. However, when they're combined in this way that I'll explain, it potentiates the whole effect overall. And basically what it's doing, it's taking things that are important to sustain our body's health from different aspects. As an example, step 1 involves magnetism through a pulsed electromagnetic field. Now, basically, it's laying on a mat for 15 to 20 minutes that's helping to charge our cells to do a few things. Number 1, to bring in nutrients from the bloodstream and remove waste products. Number 2, to get the red blood cells to optimize their ability to carry oxygen from our lungs into our tissues to be used for energy. Now, the significance is this. Everything that happens in our body, whether we're carrying oxygen, communicating through the nervous system, muscular system, everything happens because of plus and minus charges in our body. So in essence, we are electromagnetic beings in our functioning. However, we don't have a battery. The earth has been our battery for centuries. But in our modern world, we've paved over much of the earth that we experience, in the suburbs and the cities. And we also wear rubber soles, both of which buffer the earth's pulse that benefits us. So unless you're walking barefoot on the sand or the real grass at least 30 minutes a day, getting that pulse, you're losing that benefit. And on top of it, all the electricity that's above us and the wireless networks and 5G, that's actually causing the wrong charging to our cells. So it's inhibiting oxygen carrying capability. It's inhibiting our ability to bring nutrients into the cells and removing waste products from cell metabolism into the bloodstream. So step one of the protocol is to give us that charge that, again, our modern world has largely taken away from us. And a lot of people just don't get outside. A lot of people spend most of their lives indoors in the artificial environment. So they're getting exposed to things like electromagnetic fields that really take a foothold and disturb the way our bodies function. So step one, post-electromagnetic field, optimizing our cells' function and our ability to carry oxygen by those red blood cells. Step two now. Go ahead. Did you have a question?
Yes, about the mat. The mat is made out of what?
So it's got a copper coil that runs through it, and it's through that and the unit that programs it. And you could program it for different things that cause that magnetism. We even have a meter that you can actually measure, how strong that magnetic pulse is. And we actually measure in some people too that really don't get exposed outside how much EMF contamination the body has. So we're able to measure that, put them on the mat, and then afterwards see the difference in how all that EMF is drawn out of the body because it's electrical. So it's, even if it's been there for years, it can be taken out in a single session. So really effective just for overall, normal health to happen, because when our cells and all the processes in our bodies are not optimized, things are going to break down. I mean, that's going to be the bottom line.
Absolutely. And again, we had on my podcast a few weeks ago an expert on electromagnetic fields, the artificial electromagnetic fields, man-made, and how the disruption on different times when we got these big jumps from technology to technology had, coincidentally come with very severe diseases that affect us, our civilization in a big way. But other than that, he was telling about how are we living in this polluted environment because the conveniences of the electronics. Again, we need to put this in context because electronics make our lives easier. Okay, we are not going back to cook in the wood stoves and ride horses. We are riding electric cars. We have a lot of convenience at home, and this is a fact that you and I are talking on a virtual session through this technology. So what we need to do is learn how we can live in this modern world, still taking care of the very nature of our biology. So that's phenomenal. So you got this mat, and then when the patient lays there for 20 minutes, you say, what experience vibration, heat?
So that's a good question. Some people who are much more sort of internally in tune, they can feel changes in pulse rate and just different, sensations, whereas many people, and perhaps most people, aren't really aware of that. Of course, when you have a quiet environment around you and you're getting very self-aware, you can tell these things. And so the way we set it up for the protocol is we set it to this vitality setting. So our bodies are gearing up electrically to do something that's going to be exertive, because step two is exercise with oxygen therapy. Now, exercise with oxygen therapy involves a 900-liter cylinder of almost 100% pure oxygen. It's about 95% pure. So we have these compressors that take the 19 or 20% of the oxygen that's in our atmosphere and condense it to about 95% in this cylinder. And then wearing a mask, we're breathing as we're using a step or a bicycle to get our heart rates up. and to draw that oxygen into our tissues. And what's interesting, and I noticed the first time that I did it, that typically when you do sprints, again, trying to get that heart rate up periodically throughout the exercise period, usually your earlier sprints are your best, when you have your best energy, and the later ones, you start to diminish. Well, with this, it's the opposite. Because you're getting so much high quality oxygen carrying to your tissues, that the more you do, the more you recover and your capacity gets greater. So your greatest sprints are the later ones. And then following this exercise, you then go into our photobiomodulation or light therapy. It's infrared and red. And we're driving ATP or energy production in every cell in our body. We have a very powerful unit here. It's called a Theralite Pro. It has 100,000 diodes of light that involve red light and 3 additional wavelengths of near infrared light. And so when you have oxygen being driven into these cells to use for energy, we have a highly functioning cell. Again, there's trillions of cells in our body. So if we, as an example, many people don't realize they're not getting enough oxygen. They might be shallow breathers, or because they're too much with the EMFs, they're not carrying oxygen properly. So a cell will actually still make energy using something we create ourselves called nitric monoxide. But when that happens, that cell is only driving the energy cycle twice. So think of your cells on 2 horsepower. But when oxygen is there, it displaces what we make, it gets in the cycle, and it runs it 32 times. That's 16 times more energy production per molecule per cell in our body. That's what Superhuman is. It's getting us to function in an optimal situation when it comes to energy production in every cell in our body. So the benefits, not only because of the great endurance and energy you have for the exercise, but how that carries into how your brain and your cognitive functioning is. And again, when oxygen's present, you can't have bacteria, virus, or even cancer, because those are all anaerobic environments, invaders, so to speak. So saturating yourself with oxygen in all your tissues also has that great health benefit of warding off much of what people are suffering from today.
So you created an environment in your own body that is totally the enemy of disease.
Great way to put it.
Amazing.
Love that.
Amazing. So now, this is where I get so triggered to talk to you, because I always thought that the Superhuman Protocol was only available for athletes of high performance or the super soldiers, because I saw movies where they use these technologies to train the super soldiers, and people that are basically in this very, very high physical and mental performance. And when I saw at your practice in Boca Raton, Florida, that you have this available for everybody like me or anybody out there listening right now, don't you think it's amazing that we can go and feel superhuman?
Absolutely. And one of the things that we're starting to see, and you mentioned because of the pandemic, we have quite a few people that have long COVID symptoms, and we're starting to see such a quick and complete turnaround of those symptoms by using the protocol, by getting the oxygen, because of course COVID attacks the respiratory system. So oxygen degradation in the tissues has happened, and that's largely what's causing this fatigue and what we're calling long COVID symptoms. So we've already had 2 people have a really great result by just several sessions, that all of a sudden turning around those symptoms, where they're getting back to the energy that they're used to, not having that brain fog, able to exert themselves better without getting completely out of breath. And so obviously, as you said, not just for the super athlete, but even somebody that's coming from that's coming from some kind of health deficit, and being able to turn that around so quickly.
That's so great. So now I was just thinking while you were talking about this immense amount of oxygen that you're breathing while you are in this cardio exercising. Years ago, I actually get trained in breath therapy. And it was basically, the principle was, you are bringing more oxygen and breathing more oxygen than you normally do in a rhythmic way, if we can put it that way. And by doing that, you are basically inviting the dilation of all of your veins and arteries, all your vessels, just basically that vasodilation creates a faster flow of the blood. You don't have more blood than you already have, But if your containers that are bringing everything, transporting all of that blood through your body, they get dilated, then it runs faster. And as a result of that, you will experience incredible clarity of mind in many cases, bringing back memories that you had for a very long time. Have you experienced something like that with your patients that are when they are doing the treadmill or the high intensity or cardio with the oxygen at your practice?
Yes. So one of the things, and I started 14 months ago, so this has been consistent. My dreams, first of all, I sleep way, way better. But my dreams are so vivid now that I feel like I'm living a whole other lifetime in my sleep, not like never before. And many of my other patients are saying that. So along with a much better quality of sleep, waking much more rested, having that, clarity of mind, which includes a very vivid, dream state. So that is something we've absolutely seen. In the waking hours, being able to see that clear cognitive, better memory, better problem solving and critical thinking. A lot of people that have to do that on a regular basis, they've seen an enhancement in their ability to do that. And most people don't realize this, but our brains aren't using a lot of oxygen during the day. Most of the oxygen during the day is allocated to, our working muscles and other things that might need them in the moment. It's when we're asleep that our brains are getting the dose of oxygen during that sleep state. So that is such a critical time to have ample oxygen available to the brain in that sleep state. So that's another thing that the Superhuman Protocol really lays out and helps an individual optimize.
Something else that I have seen, and I've been talking to doctors in my podcast about it, is that when people experience stress of any kind, or depression, or an emotional disruption, what is the first thing that they do? They deplete the breathing because you're holding. So the breathing is very small. You're this
Shallow.
You're stressing your body because your mind is stressed, your feelings. You are going through this. So having the opportunity to go and do this protocol to bring that oxygen and actually like kind of like reminding the body how to breathe better is amazing. And here is my next question to you. Is this protocol age restrictive?
Oh, no, not at all. In fact, we've had the opportunity since we've had this thing to have youngsters as young as 12 who are athletes through their parents trying to either gain an edge, or in one particular case is a young man that has exercise-induced asthma. And he pretty much could not get through even a single practice without having to get on the sidelines and use his inhaler. And after only 3 sessions, that was all but taken away, where he was able to make it through, and his ability to continue to breathe without having those symptoms were quickly turned around. And of course, young people, they don't have years of degenerative changes and environmental things that have affected them. So they bounce back so quickly. So that was one of the great things we saw. We also had somebody in their 70s do it who was an avid runner. And after only 3 weeks, took 4 minutes off his best particular run he did on what's called the turkey trot, which happens around Thanksgiving. He'd been doing it about 15 years. And 3 weeks into doing the protocol 3 times a week, he had shaved 4 minutes off of his best time. So that was pretty amazing too. So, and everybody in between 40s, 50s, 60s, you have a woman that's been doing it for about 3 weeks now. And most women that come in when they're looking to improve something, they want to look prettier in the mirror, things like this. This woman's statement was, I want to be 10 feet tall and bulletproof. That's her reason for doing a Superhuman Protocol. I love that. That was
amazing.
Unexpected.
Yes, of course. Why not? Now, for people that are listening right now that then may be recovering from cancer or going through, for example, cancer treatments, I have to think that this protocol may be something of extremely beneficial for somebody like that, bringing all of that energy at the cellular level, helping to take the waste away, not only the oxidation of the cells that are not good for our body, but also all of the waste from medications that they may be taking. Have you, have this kind of patients come into your practice?
Yeah, so we have patients that have had combinations of different things going on. One particular, a woman in her early 40s that had both long COVID, but also 8 years of neuropathy due to 8 years of chemotherapy that was given to her because of a poor reaction 14 years ago to a flu shot. So poor girl was really riddled and really came in for something completely different. But after she spoke to me about what she was dealing with, this was the first thing that I thought that I was going to offer her to try. And I have to tell you that within 1 month, where she was unable to even like walk on her toes because the neuropathy had really taken its toll on the strength in her legs, she was not only standing on her toes, but walking on them. Her lung capacity has increased, probably 100-fold. And now she's starting to see reversal neuropathy, which her doctors told her for years, you're never going to see this change. So we've seen that. And, the detoxification process of what having all that chemotherapy for 8 years, would do to somebody. She's turning around and she's actually doing her own little testimonial because she's tracking her numbers, her resting heart rate, and some of these other things she's looking at to see the difference since she started and what's happening in her body now, several months into it. And so she wants to log this because she wants to share this with other people.
It makes me very emotional because many people out there are very lost. And again, that's why I created this podcast, to bring awareness to many that may don't find other ways of bringing back that state of health that is so crucial. How good is to have the money in the bank? How good is to have the perfect family? How good is if you cannot enjoy them? So to me, that these technologies are available to help a healing person. It's not curing the person. It's healing at a molecular level, recharging our battery, our cells, the ATP. We need to bring more energy to the cellular level because we're not having it. We're too consumed in our jobs and we don't get in nature. A lot of people don't have the opportunity as we do. Here in Florida, we have the beach here. We can enjoy a lot of parts, but in other places of the world that may be listening at us, they don't have this. So we need to offer different protocols, different ways. And this is incredible. I just love that is available for a lot of people now, and not only the super athletes or the the super soldiers. So let's talk about the third step, Dr. Lipman. The photomodulation, big word, is just basically the red light therapy, correct?
Yes, red light and near infrared. So
Correct.
red light, we could say it's visible, but the near infrared is not visible to our eyes. However, those wavelengths are part of the treatment in this sterilite bed. And so what that is based on is just like green plants are growing from photosynthesis, taking in the sunlight, and it helps to convert chlorophyll in the plant into the energy a plant needs to grow. So our cells, every cell in our body, in the portion of our cell, the mitochondria, where energy production takes place, we have that same ability to absorb light. So red light and infrared light, that comes from the sun as well, that drives energy production. So because we have this very powerful bed, the person that goes in there is getting exposed to a high energy source of photon energy. It's light energy. And so the part of our bodies in our mitochondria that are responsible to drive ATP production. That's what's happening here. And because these lights are so numerous and so powerful, the amount of ATP production in every cell in our body that's being driven is exceedingly high. And of course, because now that we have all that high quality oxygen in that tissue, we're getting to use that oxygen immediately following that exercise with this light therapy to really optimize that 3-step process and have every cell in our body drive out inflammation, increase energy production, which helps to renew that tissue, whatever the tissue is, nerve tissue, muscle, bone, soft tissue. All of that is being renewed. So old tissue is quickly being replaced by new healthy cells that have no inflammation, because that's part of that same process as well.
So just to do a recap here, because I'm just following your logic on this, and I think it's so spot on. You got the mat to basically remove all of that bad electromagnetic fields and bringing your own electromagnetic fields to optimal, recharging your energy from within. Then you got this oxygen on this cardiovascular exercise that you do. You got your cells all oxygenated, and then you go to the red light therapy and near infrared and far infrared, all of those uh, wavelengths coming through your body and basically just double recharging your cells. Is that correct?
That's correct. You've got it spot on. And the sequencing of that is really key to be able to benefit the most by doing it in that particular order for those reasons.
Something that we have Dr. Riley Duncan at our podcast a few weeks ago. He's the founder and CEO of Clear Light Saunas, pioneer in the application of near and far infrared for healing. And we were talking about this, and he was telling me that the magic, if we can call it that way, it is beautiful how this technology comes in different wavelengths through our skin and actually penetrates between 1.5 and 2 inches in our body. So get through our organs. Imagine that you're laying there in that bed with all of these red light bulbs all surrounding you. So you're having the benefit of this recharging power to your cells, directly to your organs, to your liver, to your kidneys, to your heart, to your eyes. We do protocols to heal the eyes through the red light therapy. Grow new hair, skin. This is amazing. And I know the popularity of these treatments now is huge because people are finding it very useful for many, 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 many reasons.
Yes, absolutely. And we're fortunate now because about 4 years ago, we got our first light bed, and most people never heard of it at that point. And because of podcasts like your own and some of the other things have started to show up on the internet and people talking about these things, people are now starting to search for them. So anytime we get a new technology that nobody knows about, they're also not searching for it. However, because a lot of these technologies are starting to become popularized by people like yourself and you get others out there that are bringing this awareness to the public, we're starting to benefit from people actually looking for it. And aside from us in Boca Raton, the only other place that has something like this is down in Miami, like an hour away. So that's put us in a great position now with this awareness is growing that people can seek us out. And for me, I love working with super athletes and performance enhancement, but people that have lost their quality of life because of some deficit in their health, having somebody like that be able to come in here and turn that around, that to me, that's what really drives me and what excites me most.
Of course, because, the super athletes, the super soldiers, they already in great shape. They just want to increase their performance, get better, get stronger, get faster. Wonderful. But when you see people, even in the later ages, people like you described, the lady with cancer that went through this very, I will say the treatment for cancer is very harsh on the human biology, we all know. And people like that they really came to a condition and they can see how much they improve with the use of this protocol, I think is pretty remarkable. And for my listeners, I want them to know that we're going to be posting pictures of each of these steps of the Superhuman Protocol in our socials. So you have to see how really the machines look, how is what we're describing here with words. And also all of the links to find Dr. Lipman are going to be linked in the description box and also on the Expresso Health and Wellness podcast website. So you will have ways of getting in contact with Dr. Lipman and learn more about this protocol. So other than the Superhuman Protocol, what else do you do at your practice, Dr. Lipman?
Yeah, so one of the things that we started to do about a year ago is look at some of the biochemistry and genetics of how an individual processes the raw materials of foods or supplements into the usable form for the body. In other words, when we eat food, we just can't use the food to become nutrition for us. Our bodies have to convert some of those substances into something that our bodies can use on a cellular level. It's how we basically derive everything from our food or our supplementation for the things that we need to make, like hormones or neurotransmitters or amino acids or even B vitamins. So the fact is that about 44% of the population have either one or possibly a double mutation in some of these genes that are responsible through what's called the methylation cycle to convert those raw materials into the form that the body needs. So if you, as an example, have a mutation in the MTHFR, and that's the first gene on the cycle, and you have one from both parents, that means that gene is not working at all. You can't convert, as an example, folic acid or folate into 5-methylfolate, which ultimately becomes vitamin B12 and B6 and some of the other things up the chains. So by being able to identify this, you can know moving forward, if you're going to supplement, you have to know what form you're going to supplement in to bypass what your body's not doing. And we combine this with micronutrient testing, where we're looking not in the bloodstream at vitamin levels, because that's not where the vitamins are used, but inside the cell. We're looking into the cell to see what deficiencies exist because of these two things, because we're not converting raw materials. And as a result, we're not getting these nutrients into our cell, which is where vitamins are used and minerals to have these reactions to support cellular health. So that's one of the things that we're giving people the ability to really customize to their own body's function or dysfunction, what it is that they need to supply the raw materials that they can use to make all the thing the body needs to be able to function, at the optimal level from a health standpoint.
So if I am a patient of yours and I come and I want to know that, synthesizing this food that I eat in the right way, I'm deficient of something, what do you do? What are the steps to just go through that diagnosis?
Yeah, so the first thing we do is we do testing. We do a blood test that looks at both the methylation process, if there's any mutations, if you get a mutation from one of your parents or both parents, or you're functioning as you should, you know what parts of the cycle might need to be supplemented in a different way than the way you might be doing it. Then, of course, we're looking specifically at your deficiency. So now we have a blueprint to make the proper supplementation regimen that's customized specifically to your genetics and your deficiencies intracellularly. So having both of those components together gives you the ability to take what you need in the form you need it to make the things you need for your body to function optimally. So it's a very simple thing. In my opinion, every medical doctor should have that information day one for every patient that walks into the office. It's so impactful.
You just touched the point here. Not every doctor will do it. And again, this is awareness moment right now, folks, because if you're going to your doctor and you think that the annual visit, if you go every year, some take years to go, and they go, and in 5 minutes consultation, you're going to have everything you need, you're wrong. You need to find professionals in the healthcare, such as Dr. Lipman here, such as many others that, functional medicine doctors, that Dr. Farida Ramos that I have a few weeks ago, people that really take the time to look at you as a whole, holistically. Okay, so when you come to Dr. Lipman, he's not going to look at your shoulder because it's hurting. He's going to look at you, what is causing the pain on your shoulder. Sit down with me, tell me more about it. So when this started, it's just so our systems are together as a universe. We are a micro universe of itself, and looking at a localized pain will be missing so much. So the people have to become aware, and it's okay if you go to a doctor and in 5 minutes you say, this is not my guy. He's advising me that my cholesterol is high, that I have to eat better, and he can't even get up of his chair. Not my guy. So guys, it's okay. Move on. Go and look for other professionals that really can help you. That can help your parents if they are the ones on pain. They can help your children. We had the other day, a doctor from Texas, she's a dentist, and she was telling me the statistics about misdiagnosis on kids. They are thinking they have some kind of deficit of attention, and what they had is apnea. sleep apnea. They don't sleep well. So yeah, no surprise. They come next day to the school. They fall asleep. They're cranky. They don't pay attention. Had nothing to do with deficit of attention. The only thing they needed to be fixed was sleeping. And they are putting medications on their mouths, and they have no way of saying no, mommy. They have to obey. So it's just awareness. We need to get to the preventive side of medicine. And that's why this protocol that you're doing with the Superhuman, with this analysis, if people are getting deficient on the nutrition side, is just so important. Now, let me ask you something. Who comes to you looking for this diagnosis?
Most people access me as a chiropractic physician because of some kind of pain syndrome. So that's the predominant reason people access me. And I just want to highlight something you said before, Claudia, because it's really important. We are a very symptom-driven society in terms of where we look at what's wrong with us. So as an example, people that come in here are so focused on pointing out to me on them where their pain is. And I try to work into their mindset to change that, to say, where you're feeling pain is not where it's coming from. It's where it's ending up. Now, understanding that is extremely important for me to know how to make these corrections that is going to correct the dysfunction in you that's causing pain there. But more importantly, you have to understand the globalism of your body in terms of how integrated functioning and dysfunctioning is. I always say your body functions together and it dysfunctions together. And I don't want you to think about that pain because you're going to miss the opportunity to see how everything affects everything. And so I wanted to just highlight, because you mentioned that before, but that is so true. And, the treatment that I look at chiropractically and how I approach these things, but also too, was going back to micronutrients. If we're not making the things that we need to produce, let's say, proper neurotransmitters, let's say serotonin, what's going to be the drop-down effect of low serotonin? Depression. And what is the medical answer to that? Serotonin uptake inhibitor or antidepressants. So instead of trying to stimulate our own serotonin production, we're trying to ration what we have. That makes no sense to me. And right, it makes sense to try to figure out, why aren't you making serotonin? There's a gene mutation, there's a micronutrient deficiency, and stimulate that by changing those and restoring those pathways to make what your body's not making. So what we're calling pathology as anxiety or depression, let's say, or insomnia, it's because our bodies are missing something to function. So we're not going to be symptom oriented. We want to look globally at our systems and see what needs to be added, either as a deficiency, again, be fortified, or what obstacle might be there that might be interrupting the normal process. Because the way I see it, we're either needing to remove obstacles or fortify deficiencies to get back to our health.
This is great. And again, looking at the human body as a whole, the holistic medicine versus the localized medicine. And I think as much as we're getting informed, we get this information to people get aware, they also get to kind of like demand that kind of treatment from their providers. I doctor, and again, sometimes some doctors don't like to hear. I saw the internet, I saw a podcast, I hear a podcast, Google, and here is the internet again. Well, it's like everything. You have to sort out the information and go to sources that are reputable and professionals that really bring you some information that is valuable. So I tell my people, always do your research. Always do your research. But I think we are in a trend with people are getting more conscious about this way of holistic medicine, holistic treatment. And then because it's the only way we gotta get better as a society. We got over $4 trillion investment on the healthcare system in the US alone, and our return of investment is very poor. So we need to look at preventive medicine as an investment, as you say, because if I get better, it's not only that can pay my health, I can enjoy my family, I can enjoy this beautiful life in a much better way than if I am medicated and in pain all the time, cranky, suffering, the interaction of those medicines with my own biology. So we just need to get more into that mindset of getting preventive.
Yes, and it just takes not only awareness, but one to take responsibility for themselves. I'm the one that's walking around in this body every day. I can't rely on somebody else to make it work for me. Same for you. We all have to take that responsibility. We have to change our way of thinking that we go to doctors when we're sick. No, we have to seek out those things that are going to keep us from getting sick by stimulating our body's own natural abilities to keep us well, to keep our immune system strong. Not through an injection that's supposed to ward off or minimize a viral effect, by giving the body what it needs for its own immune system, which has gotten us through centuries and centuries of existence. And that's what we have to tap into. We just need a countermeasure to the downside effect of what the modern world is doing to us. Again, like you say, there's a two-way street here. Some of the things about technology are very useful. It allows us to have a podcast and share information with a lot of people. But at the same time, exposure, and as you said, as new technologies come, our health began to fail. It was no coincidence. It doesn't exist. So there's reasons for it. So we have to just arm ourselves with information to know how to manage all that, to keep ourselves free from the downside effect and to be able to enjoy the upside effect of these things. But again, you have to take responsibility, and it's got to be something that's very deliberate and takes an awareness and an education. And you have to, find it maybe in many sources. It can't be just in one place. So you just have to be driven to want to do that, I think.
Absolutely. So back to the Superhuman Protocol, it is the 3 steps right now. Are you looking into implement other steps, or they have to be taken 1 to 3 to get the most benefit of it? What is happening on that area?
Yeah, so the protocol itself is really optimizing, again, as you kind of summarized before, our body's ingestion and utilization of oxygen for energy production in all our cells and oxygen saturation. But we have other things here that we utilize. My own chiropractic care. With chiropractic, for me, it's not just about helping to treat an injury, but it's getting the body from a musculoskeletal, neurological, vascular deficiency or dysfunction and optimize all of that. So the more our blood is flowing and our nerve is flowing, we're going to have that stimulation. So people that use my chiropractic care and Superhuman Protocol and whole body vibration, which we use here to help improve circulation, balance, posture, all these things have people leaving here, feeling like $1 million, because there's so many avenues that we're adding and integrating all these things. It's not just Superhuman. It is chiropractic care. It's whole body cryotherapy, that very intense cold stimulation for 3 minutes that sets through a whole cascade of physiological responses that are very, very beneficial for the body. So the more of these things that are integrated, the greater the outcome of health for these people. And I love the fact that you have this other doctor that's using the near and far infrared saunas with the light therapy and salt therapy, because that's something that I've, long knew that are
Yes.
also great therapies to integrate too.
Oh, it's amazing. I mean, I have a sauna in my house, so I have the infrared sauna and also the red light therapy. And now I'm gonna integrate the halo therapy. It's coming next week, which is a device that mixed very fine particles of salt while I'm taking my sauna. So that gets into my lungs and detox my cells and take the waste away from my body, reducing inflammation. And if you have a respiratory condition, people with COVID, maybe it can be, it's just can be something very useful. Then it's gonna help the whole detoxification to happen, and also the clear the lungs and liquefy the mucus, so you can just basically cough it out. So everything that you can do to be the best possible version of yourself, I think is all valid. We are investing in our future, so to speak, in our upcoming years. We want to live longer, love longer, be happier, and be able to enjoy our family and our life. So I think what you're doing is terrific, and I invite the people to take a look at your website and your services. And if you are in South Florida, just pay you a visit, because this is really, really interesting what you're doing at your practice.
Yeah, and I always encourage people, even just to come in and take a look see, with no obligation to do anything, but just to come see something that they haven't seen before and understand the benefits. I think this kind of setup, and we want to expand and add some of the things that you just spoke about, is really the cornerstone of a preventative healthcare system. So a healthcare system that supersedes treatment of things when things go wrong, but more of a place to come if you can't have it in your own home, to invest and make it part of your lifestyle, to implement these things for yourself. And to me, that's a true healthcare system, reestablishing and maintaining and even proliferating health beyond what we've, been able to do in these last, 50 to 100 years, I'd say.
Absolutely. I mean, you met my husband. He's going to be 75 years old. And when somebody asks him, who is your healthcare provider? He say, me? I am my healthcare provider. I am the one who takes responsibility of what I'm eating, that I want to eat. If I want to eat nutrient-dense foods that really my body needs for this stage of my life. I want to do my exercise, daily exercise, heavy weight, training, resisting training. I want to take the supplements that my body needs. I want to be the superhuman because I want to be alive, to see my grandchildren, to grow with see my family happy, love longer. Why not? So I just love, and this is something beautiful to see here in Florida, because we have our senior population here is very vibrant. And I know a lot of people listening at us right now gonna be very interested on learning more about your services and what you do, because if all of these technologies are available for us to become a better version of ourselves, hey, I'm in, and like me, probably many others.
Yeah, let's just do it. Let's do it.
Let's do it. Let's do it. So, Dr. Lipman, what else is coming to your practice? Do you have any news technologies that you're bringing? What is going to happen in the near future?
Yeah, so I recently hired a nurse practitioner because we want to start doing some regenerative medicine. In other words, when things in the tendons or the joints and the ligaments start to break down, instead of waiting for it to get to the point where you have to replace a knee joint or a shoulder joint, you could actually use biologics, things that people make, that you can draw blood and spin it down and inject platelets, as an example.
So PRP.
Yeah, PRP. You can use ozone to actually help to supersaturate the tissues with oxygen. Remember, ozone's oxygen, but it's 3 molecules. We breathe in O2, but when you add that third molecule, it becomes a supersaturation on a local level of oxygen to help regenerate degenerative tissue. Because to me, I would rather regenerate things as I go along and stimulate that process, as opposed to just, waiting for the wear and tear of life to get you to the point where you got to do something surgically, or you just have a debilitation of a particular part of your body, or overall. So this is something else too. And these are all new and exciting, aspects of, I'll call it medicine, but it's regenerative, as opposed to, treating symptoms and using things like cortisone that ultimately weaken the tissue, even though they have a temporary anti-inflammatory effect.
So that ozone therapy that you're bringing soon to your practice is basically localized injection of ozone. How that works?
Yeah. So let's say you have some tendonitis in one or two of your tendons in your shoulder. So we identify that either through MRI and or through sonogram, and we can actually locate the area and direct a needle to go with that, with that gas. And sometimes we could even mix it with PRP as well. And to help, again, stimulate a regenerative process in the body, where you're kind of hacking the body to send way more growth factors to that area than it would normally be doing or had been doing up to that point. And you could actually do this as a transfusion too. So we're looking into doing that, where you're getting ozone to go throughout your entire body as a regenerative process of, again, supersaturating the tissues with oxygen through the ozone delivery system.
So for our audience out there, sometimes acronyms get a little confused. And what is PRP? Let's explain what is PRP.
Yeah, so PRP stands for platelet-rich plasma. Platelets are the part of our bloodstream, these cells that are responsible to aggregate to an area of injury, whether you cut your skin or you have a tear in a tendon or a ligament. And those are the first parts of our bloodstream that go to that area. And they are responsible to attract things like fibrin and stem cells to help regrow those areas. However, for whatever reason, sometimes the body doesn't put all the resources to that area to completely heal it. Or maybe because there's a repetitive stress on, let's say, a tendon, maybe from working out or something that you're doing in your job. So that the amount of resource that the body's directing there isn't enough to completely heal it. So we trick the body by taking blood from the individual, spinning it down and separating that layer that's just platelets, drawing that out with a syringe and injecting that specifically at the spot of that injury. So that tricks the body into sending way more growth factors and resources to that site that it had been doing on its own. So you're still using your own body's very tissues and cell structures to do what it normally does, but you're tricking it to do it at a much higher level.
Okay, and when we're gonna have those technologies, the ozone and the PRP, available at your practice?
Yeah, so the PRP, actually, we've just started to implement it now. Our nurse practitioner has already done some work here and going to continue to grow this. It's something I've believed in for about 5 or 6 years, but I've referred it out to other practitioners who do it. But because of some of the law changes during the pandemic that gave nurse practitioners a little more autonomy, I'm able now to do that. And I figured, why not bring it in here because I believe in it instead of sending it out? And it just gives me another service that can help a lot of people, because many people, especially after 50s or 60s, the kind of repair they need is more than just what their own body's doing. And so be able to offer this regenerative style medicine and even just put that mindset that regenerative medicine is something that should be more of a mainstream thing as opposed to just more of a fringe thing that only certain doctors are doing. So things are changing, fortunately, because there are people out there that want to take charge of their health, but they're looking for, someone like me or someone like you that has these resources to share with people so they become aware of them and will, be able to take advantage of them much more readily because of that.
And another thing is that this video is going to be live in 26 different channels around the world. And once you post it, it stays there. So, people will find it now or in a week from now or in a month from now. And still it's going to be good because they can look for this help they probably are needed so much at that specific moment. So something else, I just got this thought right now. Do you think that the protocols that you're doing at your practice are anti-aging, or in better words, are for better aging?
I'm going to use a different word than you're using. I'm going to call it youthing instead of aging. Youthing. Youthing instead of aging, going the whole other way. So we're going the opposite way to youth, back to youth instead of towards aging. So youthing is the word I'd like to claim right here as we're speaking. Yes.
So we're having people getting younger just for implementing those protocols. I love it.
Absolutely. Yep.
I love it. Very nice. Very nice. I like that, Dr. Lipman. So I think this has been a terrific conversation with you. I appreciate very much your knowledge and expertise today. And I hope our listeners find this information helpful. Especially, we want them to turn those wheels on their minds and get more into the preventive medicine, preventive measurements, protocols and treatments and technologies that are available for us to use. So
absolutely,
I appreciate very much for you coming with us today.
I hope you enjoy our chat with Dr. David Lipman on the Superhuman Protocol. We learn from him of all of the benefits, all these technologies that are helping many to achieve much better health and performance and physical performance. So if you like the content of my podcast, please subscribe right here. Don't forget to hit the notification button so you will be notified when we are posting more episodes of my podcast and more of this content. And if you are so kind to write a review, that will help us for others to find our content and spread the word on wellness. Also, check out our sponsors and the links, the affiliate links that we have below with amazing discounts that we are offering to you, our listeners. So thanks for listening. And again, don't forget to subscribe. Until next time, remember, health is wealth for the body, mind, and soul. Take care.
Thank you very much for listening. And if you like the information that we shared with you today, please subscribe to the Express Soul Health and Wellness podcast and follow us in the social media outlets of your choice. Until next time, please remember, health is wealth for the body, mind, and soul.